Dr. Cohen, let's talk specifically about adult orthodontics. I know we have talked a little bit about it. You have mentioned that fair share of your practice is, and there's a trend to it. And tell us why. I mean, why wouldn't a person just go and grind the teeth down and flap on a couple veneers and be done with? I mean, why would a person go through even 6 or 8 or 12 months or whatever it might be to wearing the braces and tell us why is that trend so popular?
There are a lot of people that have gone through instant orthodontics, where they actually go in and have a number of veneers put on, like you said. But if the underlying teeth are not in a relatively decent position to start with, you end up having to over-contour those veneers. Number one, they usually don't look as nice as if they're the proper thickness. But more importantly, when you start changing the thickness of the teeth, the normal pathways that the food takes, the normal massaging action of the lips and the tongue are interfered with. And so hygiene is much more difficult. Even though they look straight on the outside, they're still not straight behind the teeth and can cause a lot more problems with that. A lot of our adults come in and they need both. As an adult, if you have a bite relationship that's not good, a lot of times you end up causing a lot of extra wear and tear that, yes, I can make the teeth straight, but if you've already kind of beat them up by wearing them down or chipping them, you still need to cosmetically change those if you want that 100% smile. And veneers absolutely is the best way to do that.
I see. So sometimes they do need both treatments to make it really working. So in adults don't mind running around with braces?
Well, we have a couple things. Invisalign is available now. As an aside, I was one of the first 25 trained in the country in Invisalign. I used to lecture for them. I was on their advisory group. Did well over 300 cases in the beginning, and don't do quite as many as I used to, because now with the ability of my using SureSmile, I can have my patients done quicker. Plus, I can actually put braces behind the teeth so that you can't even see them. SureSmile allows me to do that in a way that it is much more accurate, much more controlled. The only thing with the clear aligners from Invisalign or ClearCorrect or whichever company you get them from, it still is a plastic retainer. You don't have the kind of control, and sometimes you don't have the kind of cooperation that you do when I can actually glue something on the tooth, and then I can keep control of it and make sure it goes where it's supposed to. Got
it. Okay. So basically with the with the SureSmile, the braces and the things, the wires, they go in the back, and thus they are for all purpose also invisible, right?
Yep. We can make the braces invisible by putting behind the teeth. We even have braces that are ceramics that are relatively clear. But I think what we find a lot is that a lot of our adults, they're so excited about doing something special for them, to make themselves better and improve themselves, that, wearing regular braces for 10 months to a year is almost kind of like a badge of honor for a lot of people.
Sure. You're doing something. You're showing the world that I'm taking care of my health. I'm improving myself. I can see that. I can see that. Yeah. Yep. Well, wonderful. Absolutely wonderful.